There are a few things you should know about this bill. The Republican bill is one of the largest transfers of wealth from working families to the richest people in our country. Robin Hood in reverse. The richest 400 families in America will get a $7 million tax break each year.
That was House Minority Leader Nancy Pelosi just a short time ago blasting the Republicans' plan to repeal and replace Obamacare. No shortage of drama among Republicans themselves over this bill, with members of the administration out today trying to tamp down GOP opposition. I want to bring in Republican Congressman Jim Jordan of Ohio, who introduced a clean repeal Wednesday. He's a member of the Oversight Committee and a co-founder of the conservative House Freedom Caucus, which calls the GOP health care plan Obamacare Light. Congressman, good to see you. Thank you for being with me.
Good to be with you, Ali.
Health and Human Services Secretary Tom Price, your former colleague from the House, mentioned you by name this morning when he was asked about your specific concerns. Listen to his argument.
Jim's a great guy, and the things that he mentioned, purchase across state lines, association health plans, providing more competition, all of those things are incorporated in the totality of the plan. And remember that there are some things that will occur at the same time.
Tom Cotton tweeted this morning that you guys in the House should just chill out, wait, slow down, don't rush it. Should you just sit back and wait to see these phases that they're talking about now unfold before you make a final decision about supporting this bill?
Yeah, and that's what Dr. Price was referring to, phase 3. Well, my attitude is let's do it right. I think Tom Cotton is correct. We should do this thing right. And we should do it in a way that's consistent with what we told the American people when they elected us this past fall. We should do it exactly what we told them we were going to do. So that's why I introduced yesterday something we all have agreement on, a clean repeal, because we all voted for it just about a year ago. We put it on President Obama's desk. Of course, he vetoed it. But if it goes on President Trump's desk, I think he'll sign it. I know he'll sign it. So let's go with something we can all agree on. And phase 1 would be clean repeal. Then we can still get to phase 2 and phase 3 that our leadership's talking about. But we can do it in a way that unites our party and is consistent with what we told the voters we were going to do.
So in the meantime, when you do a clean repeal, there are going to be a whole lot of people who were insured who aren't going to be insured.
This is real important. The effective date is December 31st, 2018. So there's a an off ramp. There's a phase down. We understand you need a wind down to this, but you also need at that time to create a marketplace and to do phase 2 and phase 3.
Right.
This is so logical. So we know Obamacare's a mess. Fewer choices, higher premiums, higher deductibles. It's a complete disaster.
Right.
So
I have to stop you there, sir. I have to stop you there because I hear this talking point all the time. There have always been higher premiums every year, and under Obamacare, the premium increase has been lower. I heard you guys at your press conference yesterday sort of mincing words with that one. We do have to acknowledge that. There were higher premiums before Obamacare, there are higher premiums during Obamacare, but the rate of increase has been slower.
Ali, no one's arguing that health care was wonderful before, but what we've forgotten in America is what a health care market looks like. So think about what Obamacare did. More mandates, more taxes, more regulation, drive up the cost of insurance, mandate people buy it, and if they don't, they get penalized. What kind of deal is that?
Okay.
Let's actually bring back affordable insurance for working class families.
There was never affordable insurance. And I was just saying to Bill Kristol, nowhere on the face of the earth is there a free health insurance market that works. If you could point me to one and say that a free market works, it's just one of those areas that a free market doesn't work.
It will work much better than it's working now under complete government control of health care, for goodness sake. Do you think people are satisfied now? How about people in the individual market who went from paying, single people individual market went from paying $100, $200 a month to paying $500, $600 a month for a $6,000 deductible policy?
You know, sir, that in all those countries, all the developed countries that have single-payer systems or universal health care, happiness about health care is actually substantially greater than it is in the Then
why do they all come here? Why do they all come here for treatment?
They don't all come here. Republicans say that all the time. They don't all come here. They don't all come here. People in Canada, people in Norway, people in the United Kingdom, people in Sweden, people in Denmark, they don't all come to the United States for health care. Why do you say that?
Well, because you see it all the time. People in Canada come here for extensive surgery. They come here and get it done in the United States.
Sir, I grew up in Canada. I live in Canada. My entire family's in Canada. Nobody I know ever came to the United States for health care. I'm sure you have a handful of stories about things like that. It's not actually statistically true.
Yeah, well, you think Obamacare is great? You think the idea that
no, I'm absolutely not saying that. I'm not arguing Obamacare. I'm arguing the fact that you keep on saying that a free market works. But just name me one country One country in the world where a free market system for health care works.
We just had an election in last November where this was a huge issue, and we told the American people what we were going to do, and we said we were going to repeal it. We didn't say we were going to repeal it and take the Medicaid expansion and extend it. We said we were going to repeal it. We didn't say we were going to repeal it and keep a bunch of the Obamacare taxes. We said we were going to repeal it.
Okay.
So let's repeal it, clean bill. That's what I introduced yesterday, and then let's replace it with things that I think are going to help on the price of insurance.
Let me ask you this. If your goal is to kill the taxes, the tax credits, the mandates, the Medicaid expansion, what's the difficulty in doing that in a new bill which lets Americans know what kind of health care plan you think the government should be involved in, unless you think the government shouldn't be involved in anything?
No. If we could get agreement on that, all that, I'm fine with the replacement at the same time. In fact, we've introduced a replacement bill. It's a separate bill. If they could be married, I'm fine with it if it's the right kind of replacement, and actually, I believe, going to bring down the cost of insurance for working class families, middle class families. But if I don't believe that's going to be the outcome, then I don't want to support it. I want to change it.
Do you have some sense of what that outcome looks like? In other words, are you comfortable that the government has some role in health care for those millions of Americans for whom the public markets don't work?
Of course. We've had Medicaid and Medicare for a long, long time. Medicaid, though, is supposed to be for the disabled, the really low, extremely low income. It's supposed to be for specific populations. What Obamacare did is expand it to able-bodied adults, able-bodied people. That, I think, is a problem. I would much rather, instead of putting those people on a government program, I'd rather bring back insurance that's affordable so working class families can say, I like that policy versus this government policy, government plan. I want to pick that policy that fits my family's needs. That's our goal. That's my goal. That's the Freedom Caucus goal. And that's why we're opposed currently to the legislation.
Congressman, I'm enjoying the discussion with you. I got to go, but I would love it if next time we talk, you had some statistics on any plan anywhere that is an entire free market system that works anywhere in the world.
I just talked about Medicaid. I just talked about Medicaid. I didn't say
about a
complete free
Medicaid's
market.
a government program, sir. You can't talk about that as a free market system. It's a government program.
No, I know.
Can't insult the government all show and then say you really like Medicaid.
I didn't say that either. I said there's a need for Medicaid for the disabled and the traditional populations that it is served. I understand that. But I don't think we should be expanding it and say, oh, putting more people on a Medicaid program is better than bringing back affordable insurance that meets their needs.
At least I got you to admit you sort of like government. Congressman, good to see you. Thank you for joining me.
Good to be with you, brother.
Congressman Jim Jordan, Republican Congressman of Ohio. All right.